Today we'll discuss CHADS2 score, which is used for assessing the risk of stroke in patients with atrial fibrillation. And it is also used to determine if the anticoagulation therapy or antiplatelet therapy is required or not in these patients. Higher the score, greater is the risk of stroke. C in CHADS2 score stands for congestive heart failure. H stands for hypertension. A for age greater than or equal to 75. D for diabetes mellitus. And S for previous transient ischemic attack or stroke. Each factor scores 1 except previous transient ischemic attack or stroke, which scores 2. If the score is 0, there is low risk of stroke in the patient and no treatment is required, or the patient can be put on aspirin. If the score is 1, the risk of stroke is moderate and the patient can be put on aspirin or warfarin. Score of 2 or greater implies that there is moderate or high risk of stroke and the patient should be put on warfarin. Let's discuss a clinical case. 71 years old male, newly diagnosed with atrial fibrillation. History of hypertension and diabetes is positive. There is no history of transient ischemic attack or stroke. He had MI 2 years ago. Since then had intermittent congestive heart failure with exacerbation 1 month ago. He is now assessed for stroke risk and considered for antithrombotic therapy. What is the CHADS2 score? Let's calculate it first. Age is less than 75, so 0. Newly diagnosed with atrial fibrillation, history of hypertension and diabetes is positive. Each factor given a score of 1. No history of transient ischemic attack or stroke. Had MI 2 years ago. Since then had intermittent congestive heart failure. Congestive heart failure, a score of 1. So hypertension, diabetes and congestive heart failure, a total score of 3. Is there any stroke risk? Yes. A score of 2 or more implies a high risk. Should we give antithrombotic therapy? Yes. The patient should be put on warfarin because the score is 3. Thanks for watching.